You're listening to Soundside. I'm Libby Dankman. Washington is more than 5 months into a new pilot program that has been using AI to screen requested procedures for people enrolled in Medicare. It's called the Wasteful and Inappropriate Service Reduction, or WISER program, and it incentivizes private companies to deny procedures. Washington lawmakers and medical professionals say the program has led to denials and delays in care for older residents. All of this is covered in a new story from KUOW that looks at the pushback to the pilot program. Stephen Howie is a senior online editor and reporter at KUOW. Thank you so much for being here, Howie, and thanks for the story.
Yeah, thank you. Thanks for having me.
So what led you to report on this?
The reason I got involved in this was there were a lot of Washington lawmakers who were trying to prevent it from going into effect last year. So I wrote a kind of preview article about what their concerns were. They were worried that it was going to do to traditional Medicare the same thing that was happening in what's called Medicare Advantage, which is to require prior authorization using AI. And what AI does is it denies a lot of claims initially, and then people have to fight to have them overturned. So there was a lot of concern about this last year when this came out.
And so now the program started in January. We're one of a handful of other states who are piloting this program. And this is particularly new because it is traditional Medicare patients who are experiencing this, not Medicare Advantage, which already had this sort of review process with AI going on. So tell us about this WISER program specifically with traditional Medicare. How does it work?
So the idea is that the government hires these private companies who then screen certain procedures on a list. So there's 13 different procedures on a list. There's a wide variety of procedures included in that. There's epidural, cervical injections, there's skin tissue replacement, there's all kinds of nerve treatments for impotence. And what happens is the company that's hired uses AI to do a screening of those procedures before they get to either approve or deny them before the person can proceed.
And this is something, it's targeting what are known as low-value services in this program. What counts as a low-value service under WISER?
So it's one of those programs where I think there's a certain basis that makes sense, and then it kind of explodes everything just to kind of fix that one thing. And I think that the thing that they really feel like is overcharging Medicare is skin substitutes, which accounts for about 83% of all the charges that they're targeting.
And what does that mean, skin substitutes? What kind of procedure?
So when you have a procedure to replace skin with something else, or has to use skin from one place to put it somewhere else. So those procedures have really increased in price. And some people claim that that is price gouging that aren't necessary. So I feel like they grab onto that kind of low-hanging fruit and then add all these other procedures. And then they'll use the cost savings from that procedure to justify the expansion of this program of prior authorization to other procedures as the years go on. I mean, you don't make a 6-year pilot program unless you're thinking, oh, we're going to start this, we're going to say, look how great it's doing, and then expand it to other procedures and other areas. So that's the fear, anyway, is that this is the first step toward privatizing Medicare.
So some of these procedures that might be denied through this AI review, besides the skin substitutes, what sort of procedures are we talking about?
Here's what we have. We have steroid injections for pain management, cervical fusion, arthroscopic knee surgery, diagnosis and treatment of impotence, and certain skin and tissue substitutes that I mentioned before. And just as an example, the UW Medicine reported that they have 100 patients waiting for epidural steroid pain injections to be improved right now.
Wow. And so, again, these are labeled low-value services in some cases through the WISER program. But for somebody who's waiting for pain management, I would imagine that doesn't feel like a low value service to them right now. We're going to get to more of that in just a second. So again, for some people on Medicare, prior authorization has already been this requirement for some time. And again, Medicare Advantage program has had this in place. So why are people worried specifically about this change coming to traditional Medicare?
Well, I think the key to that is that what we're seeing in Medicare Advantage are a lot of problems with this type of thing. There's been congressional investigations, there's been class action lawsuits against two different companies. And I think what kind of shocked people is that literally weeks before this WISER program was announced, the department run by Medicare and Medicaid Services Administrator Mehmet Oz announced that they were having a roundtable with all these leaders, and everyone pledged that we're going to do better in this regard. So it was kind of like weeks before they announced this program, it sounded like Medicare Advantage was moving away from this model because there was such a backlash against like delayed and denied care using AI.
WISER is only in a few states. Again, Washington is one of the pilot program states. Do we know why Washington?
That's a great question, and I was unable to find an answer to that question. One of the people from the Washington State Hospital Association said sarcastically, we won the lottery, but not in a fun way where you get lots of money, but instead you get lots more paperwork, at least from their perspective.
To be clear, though, I mean, my first instinct was, is it only blue states where this is being piloted? But there are like Ohio, Oklahoma, Texas, Arizona, like there are other places with different politics that this has also been piloted in. So it doesn't seem like, on the surface at least, that it is, political retribution or anything like that motivating this.
No, it doesn't. It doesn't seem like that. You would think that with the Republican strongholds that are included in this program, that Congress would be able to at least put a stop on it or at least amend it. But that hasn't been the case so far.
So tell me about your conversations with medical professionals about all of this. What are they seeing in the first 5 months of the WISER AI review of Medicare procedures pilot program?
So they're seeing a lot of delays. And the one thing that this program promised was that because we're using AI, it's only going to take 1 to 3 days to sort through and approve or deny these claims. And what they're seeing is, in fact, that these claims that were approved or denied before the program started in 1 to 3 days are now taking 15 to 20 days. At least that's in the case of the 4 hospitals that are involved with UW Medicine. And then statewide, we're still waiting for an official survey. So this is kind of anecdotal, but the Washington State Hospital Association did a kind of call out to see how people were doing. And 16 Washington hospitals responded that the delays for prior authorization had gone from 2 weeks to 6 to 8 weeks. So more than doubled, and sometimes more than 4 times the wait for approvals. So I think that physicians are frustrated because, I mean, they're the ones who are making these requests, right? It's not like a patient is saying, I really want this, cervical steroid injection, right? It's part of the larger procedure that's being planned and being scheduled, and then they're running into these paperwork delays. So hospitals, which are, as you probably know, are already stretched thin in terms of their resources at the moment, are having to hire more people to deal with the paperwork that's involved in this process. It's like another middleman has been put into the medical procedure process.
Yeah, Beth Zabrowski spoke to that issue for your reporting. She is with the Hospital Association. We have a clip of that here.
There's already a shortage of workforce. It's already hard to get into the doctor. Like, having this additional barrier for our senior population is really a challenge.
Yeah, we all know that it's already hard to get into the doctor's office, right? I have big, long wait times for all kinds of specialists that I want to go see and things like that. What are the concerns specifically for the older population on Medicare that you heard from these healthcare providers?
I think that everything is kind of more extreme or exaggerated with that population. I mean, there was a case, at least one case, in terms of those lawsuits against Medicare Advantage with the use of these systems, that someone died while they were trying to appeal their claim denial. So that's the ultimate cost, I guess, is that people could be denied care, delayed care, and could have worse outcomes as a result of this. I know that in the case of people who are living with pain, like the Seattle Times did a great story by Jessica Fu about a person who had very bad back pain. The hospital officials told me, when you aren't able to get this pain relief, that also opens people up to using opioids potentially, to try to relieve the pain. And there's a lot of fears of addiction. So it's really, there's a lot of concern for Washington State seniors in terms of what's happening with this program.
So this program in Washington is being run by a contractor called Vertex Health. Can you tell me more about them and also what you heard back when you reached out to them?
I'm very suspicious that what I heard back was AI generated, just to put that out there. But
why do you think that? Because of the way the statement was written?
Because of the way the statement was written, it didn't feel like a real specific response. It just felt like something that was boilerplate. So
yeah,
it made me wonder.
Sometimes PR responses are boilerplate. To be fair,
that's true. And the thing about Vertex is that it's really a hard company to research. That's one of the things I would like to follow up on, is to find out more about the company. It's a coding company that's based in Arizona. They've done work in the area of working with Medicare Advantage insurers on coding, which is kind of ironic because that's one of the things that the federal government complained about in that roundtable discussion, is the use of coding to increase the costs for Medicare, because a lot of the times they add codes to make people seem sicker than they are to get insurers reimbursed at higher rates. So, but maybe that means that this company knows what to look for. I don't know. It's hard to say because we didn't get a lot of response and reaction to the company, or from the company, I should say.
So the statement that you got says, as with any pilot program, the implementation of prior authorization has presented challenges that have tested existing provider workflows to ensure patients receive the best care. That's a statement to KUOW. Stephen Howie, the reporter on this story, who I'm talking to right now on Soundside. You're listening to Soundside on KUOW. So technically, the WISER program requires that every claim denied by AI is reviewed by a medical professional, so by a human. But it sounds like the people you spoke to for this story are suspicious that perhaps that is not always happening. Can you talk more about that?
Yeah, the Washington State Medical Association told me that doctors were wondering whether these denials were made by humans because they were so they had no justification for why they were being denied. It just seemed like it was more likely by a robot.
And not getting the kind of review that was supposed to come from a human provider.
Exactly, yes.
So you also reported that Democratic lawmakers in Washington are really fired up about this. They're pushing back on the WISER pilot program. We have a little bit of that from Representative Susan DelBene here.
This now means that people's care is being delayed or denied, and without really any clear guidelines. And so it has been hard for folks across our state and hard for the medical community who are used to trying to provide timely care, now being subject to prior authorization without clear rules.
A number of other lawmakers sent statements or have spoken on this. Senators Maureen Cantwell are really upset about the program, want to end it. So at this point in Congress, Democrats have introduced this Congressional Review Act to repeal the program. Where does that stand?
There's a lot of force behind it, and they only need a majority. But so far, they've only got Democrats supporting it. And like we mentioned earlier, there are some Republican strongholds where this is taking effect. So they're hoping to get some Republican support. But we haven't seen any so far.
And what's next at this point for Wiser?
Well, the hope among Washington state physicians is that things improve. The Vertex company did hold a meeting with state physicians last week, and 185 people showed up. They were supposed to get to the questions, and the organizers kept saying, you know, we're seeing all these questions, we're going to get to them at the end, and then they didn't. So I think that the fear is this lack of transparency that's kind of been involved in this, and a part of it from the beginning is going to continue. And I think that doctors and hospitals are just trying to figure out how we work with this, and lawmakers are trying to figure out how do we get rid of this program so doesn't become part of Medicare permanently.
Stephen Howie is a senior online editor and reporter at KUOW. His most recent story is called "Washington Seniors Face Denied Delayed Care Under AI Medicare Review Program." That program is called Wiser. Stephen, thank you so much.
Thank you. Thanks, Libby.
Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org or on your favorite podcast app.